Hello, and welcome to Texas Health Plano. I want to take a few minutes to share some information related to entering our hospital for our pregnant, laboring, postpartum, or any parent or guardian of an infant in the neonatal intensive care unit, or NICU. Texas Health is committed to limiting exposure risk of COVID-19 to our patients, their families, the physicians on our medical staff, our healthcare team, and our communities. This has required us to make changes on entrance into our facilities, as well as updates to our visitation policy. We want you to know that while we have implemented many necessary safety changes, we remain dedicated to making your birth experience a very positive and memorable time for your family. While we are unable to give you a personal tour at this time, following this short video, I want to encourage you to take a virtual tour of our maternity services by visiting texashealth.org/Plano-baby. Please understand that the virtual tour does not include the changes I am discussing here, but will give you an opportunity to see our labor and delivery department and postpartum rooms. So let's get started. During this video, Cheryl Walker, one of our childbirth educators, will enter the hospital and go to the labor and delivery floor. If you come to the hospital between the hours of 5 a.m. and 6 p.m., please park your car in the front lot or garage if you prefer. Shuttle services are available Monday through Friday from 8 a.m. to 6 p.m. Our driver is happy to escort you to the front door as you enter and again back to your car when leaving the facility. Valet services are unavailable at this time. Please enter through the sliding doors at the main hospital entrance. Upon entering the building, you will be greeted by our first set of screeners. After leaving this station, if you are going to labor and delivery or the outpatient breastfeeding clinic, please walk to the A Tower elevators on your right. These elevators are across from the Starbucks coffee shop. Take the elevator to the third floor where you will be greeted by our second screeners. You will notice after entering the hospital that all employees, visitors, and patients are required to wear a mask when in our hallways or public areas throughout the hospital. Additionally, we require social distancing of at least 6 feet from others, practice of good hand hygiene, and complying with directions from the hospital staff. Due to the vulnerability of our pregnant patients and newborns, we have set up a second station where your support person will receive the wristband identifying him or her as your one visitor throughout your hospital stay. For all patients in the maternity services area, only one visitor will be permitted. This visitor cannot change and will be your support person in labor and delivery and during your postpartum stay. No visitors under the age of 16 will be allowed into the hospital at this time. Once this second screening is complete, you will enter into labor and delivery. If you are a postpartum family and are bringing your baby to the Outpatient Breastfeeding Resource Center, you will walk down the hall and find the clinic on your right. For those of you in need of breastfeeding support after discharge, please call our Outpatient Breastfeeding Resource Center at 972-981-3788. Our phones are answered 7 days a week between 10 a.m. and 5 p.m. One of our board-certified lactation consultants are happy to provide phone support and assistance during this time. Now we would like to show you how to enter our hospital if you are coming to the hospital after 6 p.m. During these times, unless instructed to do something different by your doctor, you will need to enter the building through the emergency department. We will go there now. This is our emergency department entrance. You can park your car in this parking lot and enter through these doors. This entrance is located at the far end of the hospital facing Communications Road. We don't want you to worry about entering through the emergency department. You are only entering through these doors because the other entrances are closed. As you enter, you will be greeted by our screeners and directed to labor and delivery. If you need a wheelchair, please request one here. So, just to review, the main hospital front doors are closed after 6 p.m. every day. They reopen again at 5 a.m. Again, unless you have been specifically instructed to do something different, if it is after 6 p.m., please plan to enter through the emergency department and go directly to labor and delivery. If you have a baby in the NICU, 2 parents or a parent and a guardian are permitted to care for and visit the baby. To keep our preterm and sick babies protected, each time you come to visit your baby in the NICU, you will go through a screening process prior to entrance. Please check with your NICU nurse to find out any specific visitation updates, as these recommendations may change as we work to keep our littlest ones safe. When you are screened at the NICU front desk, you will be asked to silence your cell phone and place it in a protective bag. Any other personal belongings can be placed in a locker or will be placed in a plastic bag before you are permitted to enter the NICU. Only 2 parents are permitted to visit the NICU infant throughout their stay, preferably 1 parent at a time. Please keep in mind that our current policies are ever-changing during this COVID-19 pandemic. If you have any questions or concerns, please talk to your healthcare provider. At this time, our cafeteria and Starbucks Cafe have limited hours during the week and are closed on weekends. There is a Fresh Market Cafe located on the 2nd floor of Tower C with a variety of food items and is accessible 24 hours a day. We thank you for trusting us with this most special time of your life, and we want you to know that we will continue to work in an effort to keep you, your family, and our community safe.